Welcome to this episode of Lifestyle Matters. I'm Savina Nithyanandan, and I am once again joined by Dr. Debby Utama, an obstetrician and gynecologist from Melbourne, Victoria. Welcome, Debbie. Thanks for coming back.
Thanks for having me, Savina. Hi, everyone.
So today I thought we might talk a little bit about preconception care. Now, I know as a GP, as a female GP, actually, I have quite a lot of women who fall pregnant, but only a handful of them actually come to me for preconception advice and preconception care. What is your experience in this area? Do you have a lot of patients who come to you about this?
Good questions. I think maybe about 50-50. I think, certainly a lot of people don't understand or don't realize that it's actually really important to see a specialist, to see a doctor before they get pregnant, to optimize their health, to one, improve their chance of getting pregnant, as well as to ensure that the pregnancy goes well. I think most people don't think that much, but or that far ahead. But yes, I can't actually stress enough the importance of seeing someone for pre-pregnancy counseling, just to improve your chances of having the best outcome in pregnancy.
And I suppose I can understand why that is the scenario. I mean, if you think about our great grandmothers and their ancestors, I mean, preconception care was not a big thing back then. You just fall pregnant and there you go. But in life now, with modernization, with technology, with the food that we eat, the sedentary lifestyle that we lead, there are lots more diseases, lots more risk factors we have just brought on ourselves, which perhaps our ancestors didn't have to deal with. And that's probably one of the reasons why fertility is such a big thing these days, isn't it?
Oh yeah, for sure. And there's a lot more things that we know as well about medicine, about preventative medicine, about poor outcomes or like complications that can happen. So definitely, and I think it reminds me of the topic of migration, about how with in comparison to the past, when our ancestors just live where they're born or where the origin of their genes, let's say. So kind of like the diet and the lifestyle is kind of like normal for their body, whereas with migration, people who have, let's say for me, an Asian gene living in a Western society with a Western diet and lifestyle, it's just complicate things
complicates the
even more.
situation a bit.
Yeah.
So I mean, if you want to take it down to lifestyle medicine and not medicalize this too much, I guess really earlier in our episodes we talked about, Fergal and myself, we sort of spoke about the 3 F's and the 3 S's. So the 3 F's being feet, being exercise, fork being what we eat, and fingers being all the recreational things, smoking and alcohol. And the 3 S's were stress. Stress obviously can affect your chances of falling pregnant, sleep, getting adequate sleep, and socialization, which also comes down to, just feeling connected and being happy and having a good social support.
Yeah.
So I thought we might break that down today a little bit more in the light of preconception care. And it'll be great if we maybe started with food, which is probably the most common thing that we all do. We do it every day. So talk us a little bit about how food affects our chances of, what should we do in terms of food when we're planning for pregnancy?
Yeah. I think food is almost like, bread and butter of everything that we do, isn't it? Like literally bread and butter. It affects us in so many ways. And certainly having a healthy diet, just like with everything, just like with normal things that we do in life, is really important. I think there's little evidence as to what actually works in terms of like preconception care. Like, there's no magic food, there's no magic pill that can help improve fertility and outcome of pregnancy. However, we do know that healthy diet means, low GI carbohydrate, high in unsaturated fat, or even high protein diet, more of plant-based protein instead of animal-based protein, has a slightly better chance with fertility. And I think, there's a studies that shows that some data that shows Mediterranean diet can help to improve fertility. I mean, again, it's not 1 = 1. Doesn't mean that if you eat Mediterranean diet, you will get pregnant, but I think it just helps to improve the fertility. And I think, I think it's pretty much, if we think about it, it's pretty much the same with every other aspect of medicine. Healthy diet full of good vitamins and minerals, really.
I suppose when you're adopting like a pretty holistic, whole food, plant-based diet, especially, you could be consuming a whole lot of your vitamins and minerals. So like your iron, your folic acid, your vitamins, you'll be getting all those naturally from these food products and less processed versions of them too. So which is really important. So that they're not packaged and saturated with a whole lot of salt and sugar. So that's all going to be helpful. And I guess that translates to really, if you're eating really well, your chances, as we know, 80% of someone trying to lose weight comes down to nutrition, weight loss. So, and that we'll come to that in a bit. But I guess what I wanted to just point out is food is so important because it also translates to weight.
Yes, for sure. And I think, again, with preconception planning or even in pregnancy, it's really ideal to have to optimize our weight, because being overweight or even being underweight can affect our chances of getting pregnant and having a healthy pregnancy.
Before we move on to that, oh, sorry, carry on. Maybe you were going to make the same point I was going to make.
Yes, maybe. I was just going to make a point about vitamins and minerals. That was a really good point, actually. That how pregnant women are, oh my God, we have to start taking multivitamin, and there's so many multivitamins out there, and everyone is like, oh, what's the best? And again, I think if you are trying to get pregnant, the only recommended supplement to take is folic acid, to start at least 3 months before conception to prevent neural tube defect. Whereas with other multivitamins and supplements, it's really not a must. It's really not recommended unless you don't have a good diet. So it is still better to have a good diet to get all that vitamins and minerals rather than taking supplement. And it's probably a lot cheaper too.
Yeah. I guess my caveat with the diet before we moved on to weight was, the usual things which I think most women know about, like, avoiding your soft cheeses, your cold cured meats, and fish. We also emphasize on eating fish as part of a normal healthy based diet, reducing red meat consumption and fish. The one thing we just need to be mindful of is the fact that, we should reduce our consumption of fish that's high in mercury. And I thought that might just be a little thing that I might want to add there. The internet's a wide source of information. There are various websites, trusted websites, that you can look at the types of fish that are high in mercury and things. But I just wanted to add that in there with the diet.
Good point.
Yeah. So you were talking about being overweight and how it increases. If you reduce weight, 5 to 10%. Weight loss improves your chances of falling pregnant, and that's the same advice we give to someone with polycystic ovary syndrome if we go back to the last episode. Tell us more about what your take is on weight and conception.
So again, like I said, having an ideal weight or optimizing your weight pre-pregnancy is really ideal, because being overweight and being underweight has risks associated with them. It reduces your chance of getting pregnant. I suppose with being overweight, it has got to do with insulin resistance and the whole PCOS cycle or pathway that then reduces your ovulation and therefore reduces your fertility. And if you don't ovulate, then your chances of getting pregnant is not there. And I think the same with being underweight. I think the body just perceives that, okay, if you're underweight, maybe then there's so much stress in the body that you're also not ovulating. Your pathway, your ovulation pathway is also shut off, and therefore not allowing ovulation. And if you don't ovulate, you can't fall pregnant either. So that's why having a optimal weight is ideal. Um, so yes, this is something that again can be discussed during preconception care, knowing what your ideal weight is to first of all achieve pregnancy. And we also know that women who are underweight is at risk of developing small for gestational age baby that can lead to issues such as preterm birth. And women who are overweight is also at higher risk of having, risk of miscarriage, risk of preterm birth, risk of gestational diabetes, and the list just goes on and on and on as well.
And then when you develop diabetes, that comes with other risks, like once again, preterm birth, miscarriages, malformations of the babies, and all those kind of things.
That's
so
right.
It kind of just links one after another. It's interesting.
Oh, yeah.
There is actually a World Health Organization commission on childhood obesity. So they actually listed preconception care as actually one of the important strategies to actually try to break the cycle of this non-communicable disease, because it's not an infectious disease. It is so much lifestyle. And they've emphasized that, if someone gets good preconception care, the chances of having diseases, that can link on from there is much lesser. So it's interesting that there's actually a commission from the World Health Organization with that.
Yeah, and we know that the baby what baby is exposed to during the pregnancy is very important to determine their future health as well.
Yeah. So it's basically, if a mom's already overweight or obese during conception, the chances, because of something they call it the fetal programming, so because they're in a certain environment, that increases their risk of having developing cardiometabolic diseases like diabetes, heart disease. So
it increases the risk of childhood diabetes.
So it's just things that you don't actually think about when you're falling pregnant. You think, right, I'm overweight, so it's going to be hard to fall pregnant. But I've fallen pregnant, but you don't actually think about the sequelae onto the child when you're pregnant, when you're falling pregnant, when you're obese. What are your thoughts about? Because I read this. It was something about dads. When dads are also obese, that can also potentially affect chances of a childhood obesity in the child. And that came down to, was it query genetics, or was it just the fact that they're growing up in an environment where both parents are obese, and this is the diet they lead, this is the lifestyle they lead, and there you have a child that's used to this environment like that. Do you have any thoughts on that?
The same. I think we don't know much, but certainly parents who are overweight or obese tend to then have children who have issues with childhood obesity, or have, like you said, an early programming of life, of diseases that they can be exposed to. And we don't know whether, is it due to genetics? But I think a lot of that is mostly due to lifestyle, because that's what the children are exposed to. I think having the genes is one thing, but you also need to have enough exposure to allow that to happen. So it is definitely a complicated topic, and it's complex, and certainly we are learning a bit more about it each day.
So moving on to exercise, we'll just quickly touch on that. Current recommendations are pretty much standard. 30 minutes 5 times a week of moderate intensity, or 75 minutes a week of rigorous intensity. Obviously, if you're not used to doing high intensity workout, don't start doing high intensity workout. I guess especially
Yeah,
if you're already pregnant, do what your body's used
yeah,
to. Um,
yeah,
and also avoiding contact sport, so don't go playing touch footy and things. And then if you fall pregnant, all those injuries and things like that. But is there anything else you'd like to add on to that before we moved on to the next thing on exercise?
yeah. So with exercise, that is mostly, yep, for pregnant women, but only if your pregnancy is pretty much uncomplicated. So if you have issues with pregnancy, such as with a preterm birth or bleeding in pregnancy, low-lying placenta, and again, the list can go on and on, it is best to discuss with your healthcare providers as to whether the generic advice for exercise, applies to you.
Yeah.
Yeah, and in pre-pregnancy care, if again, I think it is also good to tailor it accordingly. So if you are overweight, and obviously we are encouraging weight loss before trying to conceive, then yes, maybe this is a good time to join the gym to start some high intensity exercise, and that can sustain your way through pregnancy. But definitely don't pick it up if you are pregnant already. And then on the flip side, right, again, like we're talking about women who are gym junkie or are athletes, and in these women that there is high intensity exercise that it goes the opposite way, to the point that they again don't ovulate and don't have regular period and therefore can't get pregnant. So again, it's about finding the right balance of exercise as well. Mm.
Yeah, it's all a bit of this and a bit of that, isn't it?
Yeah,
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 yeah, yeah.
yeah,
Okay, so we've covered the feet, we've covered the fork, we've covered well, the weight and everything that comes with it. Let's talk about
yeah,
the fingers. Alcohol and smoking, common things that
yes,
we use,
yeah,
and lots of what I think 10% of pregnant women actually smoke. A higher amount actually drink alcohol because it's not
mm.
conceived as, oh, it's as bad as smoking. But what are some advice that you would give to women who are planning to fall pregnant in this
Yeah.
domain?
Stop smoking. Can't
Easy.
emphasize that enough. Easy, easy. I don't even have to think about it. So even when you're not pregnant, it's harmful to your health. So if you're planning to get pregnant, I think it's the right time to quit while you can. Because it's not easy. It's not easy to quit. We know that. So, before having to think about the baby, I think this is the right time to start putting your act together and stop smoking, because one, it's good for you, it's good for the baby, and it also improves fertility. We know that actually research has shown that women who smokes and partner who smokes have reduced rate of fertility. And even if they're pregnant, they have a higher risk of ectopic pregnancy, because there's a risk that the tubes are not working properly because of the smoking effect. So can't emphasize enough. And certainly, smoking in pregnancy is harmful for baby, and that puts baby at risk of IUGs, preterm birth, and just imagine the environment that this baby is in, all that smoke pollution.
And I guess that's the same thing, given that we talk about smoking. One of the other common things that people smoke would be marijuana. I mean, we could also talk about recreational drugs, but I think that's quite obvious. But the other thing is marijuana too. It's quite commonly used, and also that affects, once again, fertility and pregnancy and all that sort of stuff too.
Yeah.
What are your takes on alcohol? Going out for a Christmas function while you're pregnant.
Yeah. Now, I think this is a little bit different in the sense that whether you are pre-pregnant or during pregnancy. Certainly during pregnancy, it's easy. It's easy either way, but in pregnancy, the advice is to not drink alcohol at all. I think that's because we don't know what is the safe limit of alcohol for baby. That in that setting, the advice is to not drink at all. Pre-pregnancy, however, this is not quite clear in a sense that it's not quite clear whether drinking alcohol reduces your risk of fertility. But what we know is that heavy drinking pre-pregnancy can reduce your fertility. So I think the advice, if you are trying to get pregnant, is to drink moderately. So maybe 3 to 5 standard drinks a day. I think a week. I mean, that's
I was going to say that's a lot.
Sorry, a week.
Yeah.
Which is the normal recommendation anyway.
Yeah.
But that's only in pre-pregnancy. And I think again, if you find that you've been spent for 6 months and you want to do something about it, then maybe cutting down alcohol could be an option. But having said that, I think the research basically shows that the reduction in fertility is for heavy alcohol intake.
Yeah. Okay. And the last one is really stress and sleep and socialization. So I mean, just mental health, mental well-being, really. I cannot, as a GP, I cannot stress enough how important that is for preconception, being in the right space, treating your underlying, if you've got underlying anxiety or depression or whatever it may be, getting the appropriate help, getting on medications if you need to, having counselors, therapists, and things like that to give you the good support, because it can be quite a trying time. I think, we often take preconception, we take falling pregnant quite easy, and it actually can be quite stressful for some, and it can actually trigger off underlying mental health issues too, which then once again will then make chances of falling pregnant harder. So it's just like a vicious cycle too. What would you say on that, on those things?
Yeah, agreed. Like, I think with you, I can't stress enough the importance of getting your mental health checked before pregnancy, because like you say, trying to get pregnant can be really stressful for the couple. And I mean, if everything, first try, you get pregnant, great. But in most women, once you want to get pregnant, you want it to happen right now. And sometimes, it doesn't quite happen straight away, and that can trigger anxiety, and
sleepless nights.
That's right. And that can put a toll on relationship.
Yeah.
And even if, things happen easily, you get pregnant, pregnancy itself is a very stressful time. The hormones that causes changes in the body can cause a lot of stress, a lot of anxiety to women. There's women who feel that they have lost control of their body. The nausea, vomiting, the sleepless nights can be really can put a toll on the body as well as on the mental health.
Yeah.
And I think just the thought of like, is my baby okay? Am I doing right? You can't help it. It's just part of pregnancy. But if you have an underlying anxiety that's not being controlled, or you don't have ways to manage it, this is when we see women get into depression. And certainly we know that can happen. And we always check on, women's mental health the moment they book in pregnancy, again, around the 28 weeks check, and after the baby is born as well, because one just leads to another.
That sudden drop in the hormones post-pregnancy can, Yeah.
And the sleepless night. Oh my goodness.
Yeah, because we know that sleep is so important. That's when our body repairs itself. It sort of fixes the hormone levels, everything get back in check. And if you have disrupted sleep, that's not going to happen very well. And you're just going to wake up feeling worse and more on edge.
Yeah. And I always tell, my patients that at the end of the day, we want a healthy mom, physically and mentally, to be able to look after the baby. So if you need to take medication to achieve, good mental health, that is safe in pregnancy, because that's better than a mom who's not functioning and can't look after the baby well.
Yeah, yep. And I think one last point I'd like to add with that is that there is actually also research to show that, some moms will be like, oh, I want to be on medication because it might affect my pregnancy, the growth and things. But we also know that severe untreated depression can also have physiological effects on the growth of the baby. So, risks and benefits. Speaking to your healthcare provider, what is the right option for you is so important. And I think these are all such important things that we need to talk about in a preconception care.
Yeah.
Anything else you'd like to add before we wrap things up, Debbie, today? Because I think that was actually covered everything in a very quick, succinct.
Yeah, I agree. Yes, we are very succinct today.
Yeah. Well, I think I think the highlight of it is really, there are modifiable risk factors that we can actually get control of. Speaking to your provider, may it be your GP or may it be your obstetrician, having that appointment for preconception care is important, because there are lots of things you can do before you try to fall pregnant to increase your success and, have a healthy, happy pregnancy. Well, thank you so much for joining us again today, Debbie. I look forward to chatting with you at some point. That's all for today's episode on Lifestyle Matters. Thanks for watching. Till next time.